Hello, this is Dr. Oreen Wagner. Welcome to my Anxiety and OCD Quick Guide, Obsessive Compulsive Disorder. OCD, or Obsessive Compulsive Disorder, has two parts. There are obsessions, which are thoughts, worries, or images that just pop into someone's mind. They come out of nowhere, and they generally tend to be really bothersome or upsetting or scary or, ugly. And people don't know what they're about and why they pop into their minds. You can think of an obsession as something that's a false alarm in the mind. So the mind thinks that there's danger when there really isn't. For young children, I use the analogy of a worry bell that gets stuck in the mind, like a doorbell that doesn't stop ringing. Or you can think of it as a volume-controlled knob turned on too high, where you can hear everything. And it's uncomfortable and unpleasant. And then because people with OCD feel so uncomfortable with their obsessions or so upset, they feel like they have to do something to fix it, to make it go away. And that's what compulsions or rituals are. They're actions or things the person does to make that bad feeling go away from the obsessions. They know they don't make sense, but they can't seem to stop. And they do them over and over again in a way that doesn't make sense. And if someone else tries to stop them, they feel very upset because they think then something bad will happen, and so they have to start the ritual all over again. So that's what OCD is like. Now, OCD comes in many different flavors. So here are some different themes or topics, that people worry about with OCD. And interestingly, children, teenagers, and adults, as well as people from different cultures and in different countries, all seem to have very similar themes for their OCD. So here are some examples of those themes. And just like there are many different themes for obsessions, there are many different rituals as well. People may have one or more obsession and one or more rituals. And there are many combinations of these things. And the rituals don't always go hand in hand in a logical way either. So for instance, you might think, oh gosh, if I'm afraid of catching, hepatitis, I might be very careful to wash my hands and not touch things. And that's the logical ritual. But often, in the case of children, they may have illogical rituals, and they might think, if I touch the table 3 times and if I turn in a circle, then I won't catch hepatitis. So rituals can be confusing at times because they don't make sense to adults or people who don't have OCD because they aren't always logical. OCD generally doesn't make sense to people who don't have it. Thank you for listening. For more information about OCD, please visit my website, anxietywellness.com.